All right, Dr. Randall, thanks so much for being on this podcast with me. I appreciate it. First off, just tell the audience a little bit about yourself and how you got started in the role that you're today.
Yeah, thank you so much for having me. So my name is Stephanie Randle. I'm a pediatric neurology doctor and epilepsy doctor. I take care of children with seizures mostly as my role in epilepsy and neurology, and I work at Seattle Children's Hospital. There, I run the tuberous sclerosis complex program, which is a genetic condition that can actually lead to epilepsy, which I know we're talking about today. And I also run our epilepsy surgery program from the medical side and have loved doing it. I've been part of these two programs for the last, 9 years or so, and I'm really excited to talk to you a little bit more about epilepsy. So thanks so much for having me.
Yeah, you're welcome. So tell me a little bit about the epilepsy program. What's that all about?
Our epilepsy program is a place where we allow kids to come in to get evaluated for their epilepsy. And so that often will start with a first visit with a neurologist or an epileptologist or a neurology nurse practitioner. And in that visit, we'll ask about what a parent saw when they thought their child had a seizure, or what the child may be able to tell us about their seizure or possible seizure. We'll often do an EEG, which is a brainwave test that looks at why someone may have had a seizure or if they're actually having a seizure in this moment. And then we'll talk about medicines to treat if that's indicated. That's usually our first line of treatment when someone has a seizure is a seizure anti-seizure medication. And then I think what sets us apart from other places is if medicines don't work, we're able to offer other treatments like dietary therapy or surgery. And we're lucky at our hospital because we have a big team that helps support our kids with epilepsy, from neurologists to neurosurgeons, neuropsychologists, neuroradiologists who help us understand the MRIs, amongst many other people.
Mm-hmm. Now, now the question that has been on my mind recently is epilepsy sort of genetic? The reason I ask that is because I have a friend who has epilepsy, but his parent um also has that condition. So I'm wondering, is it genetic? Is it passed down from one generation to the next?
Really great question. Sometimes it is genetic or inherited, and sometimes it's not, and sometimes it's acquired. And so that's one of the things we do to understand why someone has epilepsy is what caused the epilepsy. So is it because they have a specific gene mutation that causes it that maybe they did inherit from a parent, just like you're saying with your friend? Or is it that they may have had a stroke or a brain tumor, or when their brain was developing, parts of it developed a little bit abnormally that led to the irritability that then causes seizures. So seizures and epilepsy can be caused by many different reasons, and certainly inherited is one of them.
Hmm. So, when someone, has epilepsy, what sorts of things do you guys do at the epilepsy program to sort of help them through that?
So we tailor our approach in a couple of different ways. First, obviously, our goal is to get the best control we can of the seizures. And sometimes that's balancing side effects of medicine. And so it may be that we're not able to get full control with the medication because, at high doses, for example, the side effects are too debilitating. And so if that's the case, and even if we do get full control, we part of our program is to help support patients and families to be successful. So we work with their school to make sure that kids are getting the right accommodations they need. We write seizure care plans in case a child has a seizure at school, so the school knows what to do. We educate families and caregivers about what to do if a child has a seizure and if they need a rescue medicine, for example, like if they had a long seizure or a cluster of repetitive seizures, then the families are taught how to give a medicine to try and stop the seizure. We talk about ways to get kids back and integrated into the community if they feel a little bit isolated. And we work really closely with our patient and family support group, particularly the Epilepsy Foundation, in really offering resources and connections with other families and kids who have epilepsy as well. It can be very isolating, and so I think our goal is really to let kids live the life they want to live and do exactly what they want to do, even if they have this condition.
Mm-hmm. And then how do you sort of help out the parents and also like other entities like the school? I know you talked a little bit about it, but could you dive into that a little bit more?
Yeah, my job as a pediatric doctor is to take care of the child, but you're never just taking care of the child, you're taking care of the whole family. And so, of course, in our clinic visits, we spend a lot of time educating the parents on what seizures look like, what to do if their child had a seizure or a breakthrough seizure if they're on a medicine. We talk a lot about what may cause someone to have a breakthrough seizure, like they may be really well controlled on their medicine and all of a sudden they had a seizure come back. Maybe it's because they're sick or they didn't sleep well, or for some, lots of different examples. Um, and then we really advocate for our families to connect with other families. As part of the Epilepsy Foundation, they have a summer camp, which has been really cool. Actually, for the first time this last summer, I was able to go, and that allows for children with epilepsy to go for free, and their siblings can join also. So I think that really helps integrate other family members and helps, bring in the siblings. They may feel isolated if their sibling is always going to the doctor or have some special needs that they're being attended to. This allows them to feel like they're, still part of the whole experience. I mentioned we work with the schools. We have a really great nursing team at our hospital, and at most schools in the area that I take care of, they will have an on-site nurse or someone that can be trained to help take care of the child if they have a seizure. And we just spend a lot of time reaching out to the schools, talking to the schools, and providing education on how to keep kids safe.
Mm-hmm. And my next question is, like, how important is connection between like parent to parent? Because oftentimes, if someone has epilepsy, you know, the parents don't know, they're kind of like lost and isolated. So how important is connection, especially like for first time parents?
I think that's really important. And that's one of the things I've been really passionate about. And one of the things that has gotten me into epilepsy is making sure we teach people about the condition and destigmatize it, and meeting other families that have gone through something that you're going through can be really powerful, because I can tell you all day long what it's like to have, or what how we treat epilepsy, but I can't tell you what it's like to live with a child with epilepsy, because I don't live that life. And so hearing from another family their experience, I think, is completely necessary. And so ways we try and do that, like I said, we connect families with other patient family organizations. So if we know why you have epilepsy, so you asked about genetic causes, sometimes we will find the genetic cause, and then we can link the family with another family who has the same genetic type of epilepsy. Sometimes it's as simple as we have an annual walk where we raise money and awareness, and our team comes, other hospitals from around the area come, and patients and families come, and that's a nice way for them to get to know one another. And then obviously things like this, like podcasts, getting information out there, Instagram, Facebook, Twitter, all those resources are really invaluable for families connecting with one another.
Mm-hmm. What have you learned in doing this kind of work at the epilepsy program?
Oh, it's every day I'm learning. Just
Mm-hmm.
when you think you know what you're doing, something new comes up. And I think one of the things that's so exciting is that we have new treatments on the horizon, and some new treatments that have even come in the 9 years that I've been doing this. We almost always start with a medicine, and then we've really shifted our focus and have been fairly quick to say to families, if medicines aren't working, every child has an option for surgery, whether it's a brain surgery or whether it's like a neuromodulation or like a pacemaker device. And that's been really exciting, because that's been new in the last 9 years that I've been doing this, that we can offer more to families and patients than we were able to in the past.
hmm And finally, this last question is important. Like you mentioned in my last question, like an effort to destigmatize, epilepsy. So how do you do that?
I think, we try and provide education to the community, not just to families and patients with epilepsy. We offer a lot of the with working with parent support groups like the Epilepsy Foundation or the TSC Alliance. They've really helped bring awareness, and I think that helps destigmatize. Each year the Mariners host Epilepsy Awareness Day at the baseball game, and so we were able to go to that this August. And it's a very common condition, and it may not be obvious when you look at someone that they have epilepsy, and that it doesn't mean that that we want to make sure that they're safe when they're out in the community. And so making sure that there's awareness out there. If someone has a seizure in front of you, it can be very scary to see, and how to keep someone safe and how to help support them through it, I think is really important.
Mm-hmm. All righty.